Hi, my name is Chris Natting. Patients sometimes ask me what kind of scan will I need to assess my head and neck cancer, either before I have treatment with you or after treatment's completed. The answer to that question will depend on exactly what we're looking for. So the most common types of cancer scan are a CT scan and MRI scan. CT scan, or CAT scan as it's sometimes known, is an X-ray scan. The advantage of this scan is that it's quick. It is able to image through the mouth and throat area as well as the chest and the rest of the body in just a minute or two of your time. Because the scan is quick, it allows assessment of the whole body quite quickly. The downsides are that CT scanning doesn't always give as much detail, particularly in areas around the brain and in some areas of the throat compared to MRI scanning. So what is MRI scanning? MRI, or magnetic resonance imaging scanning, is a more complex type of scanning, including a magnet, which is used to image the area in question. These types of scan are more relevant if you just want to image the head and neck, and particularly difficult areas around the eyes and around the brain. MRI scanning is slower. Often the scan takes an hour or longer. It's more claustrophobic because the scanner is quite tight, but it does provide better pictures in some areas of the head and neck, and that's where we use it. The other advantage of MRI scan is there's no radiation involved, and therefore, in terms of exposure to radiation, it's less risky. So talk to your oncologist about what kind of scan is required and see if they can explain where and what is required for you.